Did you just get a tooth pulled? Were you so nervous in the dental chair that you can't remember what the dentist told you to do and not to do afterwards? Did you lose the piece of paper that had the instructions printed on it and the pack of extra gauze? Well, don't worry. I'm going to go over the instructions for after tooth extractions, and I'm going to explain why you should follow them. Hey dental fans, I'm Dr. Rich, a general dentist with over 20 years of experience, teaching you about dentistry and teeth so that you can have a very nice smile. Please hit the subscribe button so that you don't miss my weekly dental videos. The issues you are going to have after having a tooth extracted are pain, swelling, bleeding, and possibly infection. Once you have your tooth pulled, you will have pain afterwards. You may have had pain before, which is probably why you had your tooth pulled. I recommend that you take some over-the-counter pain medication like ibuprofen, naproxen sodium, or Tylenol while you are still numb. Just follow the dosing instructions on the bottle or whatever your dentist recommended. If you take the pain medication while you are still numb, it will work better than if you wait for the anesthetic to wear off and the pain to start. If you can take ibuprofen, I usually recommend that over Tylenol since it acts as an anti-inflammatory, so it will help with any swelling you might experience. So that leads us into swelling. After having a single tooth extracted, you're not likely to get much swelling, but if you have multiple teeth extracted or if you have impacted wisdom teeth removed, you will have swelling. Use an ice pack or an ice bag, or even just wrap a bag of frozen peas in a towel and hold it against your face in the area of the extractions for 20 minutes. Then take a break for 20 minutes. Repeat that as often as you can for the first day after the extractions. Next on the list is bleeding. The bleeding will have stopped before you leave the dental office. You'll continue biting down on some gauze for another half hour to an hour after you leave. Once the time is up, throw out the gauze and don't use any more gauze. Only if you start bleeding again should you use gauze. If you start bleeding again, take a couple of pieces, fold them up, wet them slightly, put them over the bleeding tooth socket and bite down on them for another hour. What? You lost the little packet of extra gauze? Don't worry. Take a tea bag, wet it, squeeze out the extra water and use that instead of the gauze for an hour. Don't be afraid if you notice some blood on your pillow when you wake up in the morning. That happens. You may also notice some bruising on your cheek or neck after having a tooth pulled. That's normal. Avoid drinking any hot beverages for a couple days and skip your workout as well. Both things may cause you to start bleeding again. Now that the bleeding is stopped, you have to protect the blood clot for the next few days so that it doesn't fall out. So no rinsing, no spitting, no drinking through a straw, and no smoking. Any of those things can dislodge the blood clot. If that happens, you'll get something called dry socket. Dry socket means the jawbone is exposed in the tooth socket. It's not serious, but it really hurts and takes an extra 5 to 7 days to heal. You will most likely need to come back into the office for some further treatment. And lastly, let's talk about avoiding infection. For the next 4 weeks, avoid eating foods like nuts, popcorn, hard pretzels, and anything with a lot of seeds in it. You want to avoid small hard bits of food that can get stuck down in the extraction socket. For the first 2 days after the extraction, eat soft foods like scrambled eggs or pasta, even some soup. Starting 2 days after the extraction, I want you to start rinsing your mouth out after each meal. You can just use some warm salt water and just swish it around gently. If at any point you have a concern or a question, give me a call. Even if you don't think it's important, I want to know about it. If the pain doesn't go away or it gets worse, give me a call. If you start to run a fever, give me a call. So that sums up the instructions for after a tooth extraction. Let me know in the comments below how your extraction went. Thanks very much for watching and see you in the next video.